how much misery is there over debts and the poverty that occurs because people who don't have that access or who have a sudden need that's uninsured incur without any resource.
It's not about the money in that we can't afford to do it, because it would actually be less costly to do these things that will help people and make people less vulnerable.
I had so many patients come in to see me, and they would say, you know, I haven't had a pap smear in 10 years, 15 years. And I'm like, why haven't you had a pap smear in 15 years? And they would say, well, because I haven't had health care. It's easier to prevent disease than it is to treat disease. That's way easier than trying to treat someone who's already got cancer and needing radiation or chemotherapy.
I should not have been standing in the emergency room with my husband that was about to die, thinking in the back of my head, how on earth are we going to pay for this?
$1,500 a month for the insulin I need. And if I didn't have it, I would die.
If I hadn't have had the care that I had and went 9 months with gestational diabetes that was uncontrolled, the amount of money that they would have spent to fix whatever would have happened would have been crazy.
Without Medicaid, I just would have died. That's all there was to it. I signed up immediately. Once I got it, it took care of everything. And I wouldn't have made it. I wouldn't have made it without it.
Even though we do have a lot of services offered, a lot of people in the community either don't know that they exist to begin with, or they don't know how to access them. And so a community health worker can be the person to say, hey, there are actually a lot of things available to help the situation that you're in, and I can help you get to those places.
I do see a lot of people that are going to the doctor for the first time when I get them enrolled due to the expansion of Medicaid. A lot of people are intimidated by doctors, and a lot of times community health workers, they come in as a friend to be that one person that they're able to talk to better than the doctors.
Our clients want to be part of the community and they want to be involved, but without proper health care, that's really going to make it difficult.
Medicaid is very important to cut back on recidivism, because we know from much of the population who has been incarcerated, they struggle with mental health at a higher rate than the general population. Individuals who don't have access to health coverage or mental health treatment after release have a much higher rate of returning to prison. We want them to have a second chance.
All vaccines are incredibly important just because of that aspect that it protects not only yourself, but it protects your community as well.
Pregnant people who are vaccinated against COVID-19, their babies upon birth have significantly less complications and issues 6 months into their life thanks to those antibodies.
What's best for the common good? Less tax dollars will be spent on healthcare if we all work together to be healthy.
We can't be physically healthy. We can't take care of our mental health. We can't take care of those around us that we're responsible for.
No matter what your income level is, what your status is, what your age is, what your sex is, everybody should be able to access the same type of treatment.
Medicaid is so needed. I can't imagine the country functioning without it.
Our system was set up a long time ago. Society and our lives have just changed into something that looks a little bit different now, and it's time that our health insurance system changes right along with that.